Hello friends, perineal hernia in dogs. This is a very common condition of old intact male dogs. And this condition develops because of the rupture of the pelvic diaphragm muscles. This leads to the displacement of abdominal organs, mostly the intestinal loop or mesentery or fat, or in severe condition you will find there will be urinary bladder along with the prostate gland that gets displaced around the perianal or anal opening. Now, the important causes of this condition, that is the chronic constipation or age-related muscular weakness, or sometimes male sex hormones, especially testosterone, also found to be play important role in the development of this condition. Or due to any reason, if there is a weakness of perianal muscles or pelvic diaphragm muscles, that may result into the development of this condition. So here you will find, in clinically you will find there will be swelling either both the sides of the anal opening or one side. If one side is affected, then one side there will be swelling. If both the sides affected, you will find there is both sides swelling. Now, for examination, you may go for the radiographic examination to identify the content, or per rectal examination, you can insert your finger and you can able to check the side which is affected with this perineal hernia or pelvic diaphragm muscles damage. If you will find, suppose you are deflecting your finger toward the left side and there is no muscular resistance, that means left side muscular diaphragm is ruptured. If both sides your finger is easily deflected, that means both side bilateral perineal hernia. Now, further you will find there will be severe constipation, difficulty in passing feces. These things you may observe in such animals. In such conditions, you have to go for the surgical treatment, that is the herniorrhaphy or hernioplasty, depending upon the condition you have to perform. In herniorrhaphy, simply we are suturing the ruptured pelvic diaphragm muscles, and if the pelvic diaphragm muscles are very weak, in that condition we are putting some mesh material for mesoplasty and then we are suturing. Now, for prevention of this condition, you can prevent this condition by either you can go for the castration if you are not allowing the animal for the breeding purpose, not using the animal for the breeding purpose, then you can advise for the castration. And always try to prevent the chronic constipation. For that, you can advise high fiber diet, or in severe condition, you may advise some laxatives. That is very important to prevent this condition, because perianal surgeries most of the time results in complications also.